Since taking power in September 2022, Captain Ibrahim Traore has announced several proposed healthcare reforms. Before Traore took over control of Burkina Faso, the country was faced with severe shortages of medical supplies, equipment, and personnel, especially in rural areas. Now things are beginning to change. In today's video, we will examine how Ibrahim Traore is changing the health sector in Burkina Faso. In July, President Ibrahim Traore handed some health resources and equipment to Burkina Faso's Minister of Health, Dr. Robert J. Jean-Claude Cargogou. But before we continue, make sure you like this video and subscribe to the new Traors channel. Turn on notifications too so you get notified whenever we upload videos like this. The official handing over of the health kits worth millions of dollars was on Thursday, July 25 in Ouagadougou. The items included 1,900 solar refrigerators, 36 vehicles, 13 refrigerated, 12 station wagons, 11 pickups, 3 oxygen production units, 11 cold rooms, some 835 tablets, 110 freezers, and 14 generators. While officiating the event, President Traore reiterated that these supplies will benefit mostly vulnerable persons, particularly women in vital health operations like mammography, echography, ultrasound, and treatment of different cancers. This development follows an anti-malaria vaccine program called the Expanded Program on Immunization, dubbed EPI, which Minister Cargogou officially launched last February. Many people have lauded President Traore's actions, describing them as impressive. Traore is tackling some of the biggest health challenges in Burkina Faso by the recent provision of this health equipment. The addition of tablets, solar refrigerators, and generators is a smart idea because it will lead the country to technological advancement and progress in sustainable energy. People in remote areas of Burkina Faso are very happy about President Traore's initiative to reach out to their health needs. The clinics will be made available in all 13 regional health headquarters of Burkina Faso. It is important to note that these mobile clinics will add to some over 2,500 already existing primary healthcare units in Burkina Faso. The country already has about 6 university hospitals at the tertiary level, 13 regional hospital centers, and 1 university hospital center at the secondary level. The COVID-19 pandemic was a thorn in Burkina Faso's flesh, just like for many other countries in Africa and the world at large. Vaccination rates dropped drastically, and the country struggled to access and ensure proper mother and child care. However, instability and violence from Islamic terrorists affected the country's health functioning, and this was closely followed by attacks that left many hospitals and clinics closed. President Ibrahim Traore is very certain about his no more pain policy. He and his government have pledged to prioritize improving healthcare access and outcomes, but significant challenges remain in terms of funding, infrastructure, and security. Significant reforms and investments will be needed to strengthen and foster the health sector in Burkina Faso. You should bear with us that President Traore's gesture comes after a keen evaluation of the country's very underdeveloped healthcare system. Most hospitals in Burkina Faso are in larger towns, but the government is improving access to primary health care by increasing the number of village clinics. The main causes of death in Burkina Faso often include respiratory diseases, malaria, and diarrhea. Communicable diseases remain another cause of morbidity and mortality in Burkina Faso. Close to 20,000 malaria-related deaths were recorded in 2020. It is the #1 cause of mortality for children under the age of 5. Besides the aforementioned diseases, HIV infections, tuberculosis, leprosy, and other neglected tropical infections like river blindness are also silent killers in the country. Burkina Faso is regularly confronted with epidemic outbreaks such as measles, meningitis, and poliomyelitis. The National Information System of Burkina Faso does not make it possible to assess the rate of these diseases. Some illnesses are currently the subject of special programs to better control them. The health of vulnerable groups is influenced by communicable and non-communicable diseases, and often leads to loss of lives. A dengue fever outbreak in 2017 saw the termination of about 18 lives, along with over 9,000 infections. Cases are often recorded in the 13 health regions of the country, with over 60% coming from the central region, particularly in the city of Ouagadougou. The World Health Organization always recommends timely and adequate management of all health hazards in Burkina Faso. However, some people say Traore's predecessor, Thomas Sankara, must be smiling that his ideas have manifested in another man who got inspired to finish what he left. Strong patriots may be maltreated, misunderstood, or terminated, but their ideas still live on. Healthcare officials in Burkina Faso have expressed that they had difficulties in social promotion centers due to lack of equipment. According to them, the fight against diseases will continue, beginning with the destruction of breeding grounds. With more and better equipped health facilities, healthcare providers will be able to serve more patients and offer a wider range of services, such as preventive healthcare, diagnostic tests, and specialized treatments. One important thing that Burkinabe stakeholders should always consider is to try getting out of the list of poorest countries in the world. Rapid population growth, gender inequality, and low levels of educational attainment are still very common in this sub-Saharan country. This donation by President Traore is certainly another way to employ the people of Burkina Faso. The operation of the facilities will provide jobs for residents and contribute to the overall economic development of their communities. However, the full benefits of the mobile clinics and accompanying materials will depend on factors such as the specific needs of the communities, their coordination and integration, and the availability of experts and professionals who will better manipulate them. Bear in mind that the World Bank and other international health bodies have always supported Burkina Faso in her quest for good health and hygiene. In 2018, the bank approved a $30 million International Development Association grant and $20 million from the Global Financing Facility in support of every woman and every child in Burkina Faso. Ibrahim Traore is a Burkinabe statesman with an impressive journey. He has a bold vision for Burkina Faso. He aspires to see the country prosperous, stable, and united. He just wants everyone in his country to realize their full potential. Traore understands that education and healthcare are pillars of human development. He plans to make substantial investments in these sectors to ensure equitable access to quality education and adequate healthcare services for all Burkinabe. Traore is also very sensitive to the needs of other sectors of Burkina Faso's economy. Concerning security, he is committed to resolutely combating terrorism and insecurity that have plagued certain regions of Burkina Faso over the years. He is promoting a comprehensive security approach with Russia while avoiding any coalition with the West. He is also very engaged in the enhancement of regional cooperation with neighboring Mali and Niger. Through their union, intelligence capabilities are being developed. Talking about economic development, Ibrahim Traore has boosted economic growth by investing in so many agricultural projects, industries, infrastructures, and education. In November 2023, Burkina Faso's Council of Ministers approved the construction of the first gold refinery, which marked a significant turn-up in the country's mining sector. Traore seeks to gain more control over gold resources by refining it domestically rather than exporting unrefined minerals. You may be asking yourself why President Traore attracts so much attention. His strategies and drawbacks from any external domination have kept many people wondering about how he will survive. He is already surviving, as we can see. At a time when Africans are trying to fully free themselves from the shackles of colonialism, good examples should be followed. President Ibrahim Traore is just setting a path that could one day bring permanent glory to his country, Burkina Faso, and why not Africa at large? Is Traore getting all right, or he is not different from other African presidents, who are so much concerned about their gains rather than fighting for their people? Let us know what you think in the comments below. Before we take leave of you, make sure you like this video and subscribe to the new Tourist channel. Turn on notifications too so you get notified whenever we upload videos like this. Thanks for watching, and see you in our next video.